Welcome back to the Ed Show. Healthcare reform under siege. The lion machine, the big insurance lobby, is killing the public option, or is it? Here's what's happening with latest surveys. Righty talkers and Republicans are spreading lies and misinformation, and they are sinking in with Americans. Take a look at these numbers from a new poll commissioned by Indiana University. More than half of Republicans believe in death panels for the elderly. 2/3 of them believe a public plan would cover all illegal immigrants, and roughly 3/4 of them believe it will lead to rationing and taxpayer-funded abortion. Wow. Many Republican voters are hearing this garbage straight from elected lawmakers, so maybe those numbers aren't a surprise. The really alarming numbers are with the public option. A majority of Americans don't believe in the basic principle of having a public plan, that it would lower costs for everyone. 51% believe it would increase health care costs. 54% say it would drive up the cost of private insurance premiums, and 56% believe the United States cannot afford to pay for it. Joining me now is Dr. Aaron Carroll. He's the director of Indiana University Center for Health Policy and Professionalism Research. He's also the author of Don't Swallow Your Gum: Myths, Half-Truths, and Outright Lies about your body and health. Dr. Carroll, good to have you with us tonight. Appreciate your time. What jumps out at you at this poll? And I know it's extensive research on the university's part. What jumps out at you? What really surprises you?
I think it's not necessarily how many Republicans believe these things, but how many people overall. More than half of Americans believe so many of these myths that it's really quite clear that the administration and Congress just aren't getting the message out about what health care reform is really going to do.
Can we come to the conclusion that independents now are going to decide this health care debate in this country? Are they the key sector to watch?
I think it's likely so, knowing that there's only about so many Republicans and so many Democrats, and now just about as many independents. Looking at how many of them actually believe these myths, I think that they're really someone that the administration and Congress has to target if they're going to turn this around.
Now, well, that's the question. I mean, how would the administration turn this around? I mean, these are big numbers. Would you say that? I mean, would you agree that these are big numbers to defeat at this point?
I think that they are big numbers, but the numbers have changed over time. I don't think it's lost yet, and I think that with a good message and a big speech or a really concerted effort to be very consistent with their messaging, I think they still could turn this around.
58% believe taxpayer-funded abortions will take place in this country. What was the question? Was it just a direct question in this survey?
It was. It basically said, if the reforms pass, will the federal government pay for abortions, or would the health care reform pay for abortions? It was very non-judgmental one way or the other, just asking if they believe that the reforms in the bill would actually cover abortions, and people do.
Now, Dr. Carroll, I know you've done a lot of these surveys before at Indiana University, but if you could judge how anxious people were to talk about this, how eager they were to talk about it, how willing they were to participate, and maybe how focused they are on the issue, give us a sense.
People are really interested in talking about these things, and they're very vocal, either for or against. We had very few people who were non-committal one way or the other on almost all of these questions. Everyone had an opinion.
Everybody had an opinion. It's pretty amazing stuff. Dr. Aaron Carroll, I appreciate your time tonight on The Ed Show. Thanks so much.
Thank you.